Hello, everyone, and thank you for joining us on this episode of the Account and Coca Report. We are delighted to have as our guest Per Bylund, who is Assistant Professor of Entrepreneurship at Oklahoma State University, where he holds the Records-Johnston Professorship of Free Enterprise in the School of Entrepreneurship. He holds a PhD in Applied Economics from the University of Missouri. He's the author of numerous articles in the peer-reviewed literature and in the lay press. He writes a regular column in Entrepreneur magazine and wrote 2 books, the latest of which is entitled The Seen, the Unseen, and the Unrealized, How Regulations Affect Our Everyday Lives. Per, welcome to the show.
Thanks so much for having me.
Great to have you. You know, before we start, I was looking at your bio on your website. You've had a very diverse experience. First of all, you're from Sweden. And Sweden is sort of, people are sort of paying attention to Sweden these days. And perhaps at the end, we'll have we'll chat a little bit. I don't think this will be the focus of our conversation, but maybe we'll have a chance to address that related to the pandemic. But you lived in, you're from Sweden, you lived in Taiwan, you held some positions in, public life or political life. You worked as an entrepreneur, now you're teaching. Very interesting, very diverse. Glad to have you. Tell us a little bit. We're going to talk about regulation and then apply that to the context of the pandemic. Can you tell us about the title of your book, The Seen, the Unseen, and the Unrealized?
Yeah, of course. It's really a way of playing off of a famous essay by a French economist in the mid-19th century, Frédéric Bastiat, who wrote about the fallacy of the broken window, where he argued that there's one way of telling a good economist from a bad economist. And the good economist would be the person who just see what is there and what is happening. And the good economist would be the one who sees what is there and he sees what we're missing, what is not there, the unseen. So he used a broken window to illustrate this, saying basically that a child breaks a window, and that means that whoever owns the window has to buy a new window, and that means new business for the glazer, who gets more income, and that means that the glazer can buy more stuff. So look at that. A whole lot of stuff is happening in the economy, and many people get improved income. That's got to be a good thing, right? And we see people using this type of reasoning today too, like the Nobel laureate Paul Krugman. He is using this type of reasoning, although he claims it's not. One of his examples has been to suggest that we have a planetary defense against a Martian attack, because then everybody would invest a lot of money and a lot of effort into this defense. Right. Meaning, of course, then that they would create a lot of jobs and people would get wages and they would get salaries and they would have money to spend and everything would be beautiful.
Maybe a virus can do that too.
Maybe a virus can do that too.
If it weren't for the lockdowns, yes.
Exactly. So Bastiat argued that no, the good economists would see that, well, if you don't break the window, that money is still there. So the owner of the window would probably choose to use the money for something else. Maybe he would buy a new coat or a pair of shoes or something like that. And that would be a new business for the coat maker and that business is simply lost because instead he has to replace the window. So we have to look at both what we're seeing and what we're not seeing. So in Krugman's example, then with the planetary defense, well, that means we're directing resources that would have been used in who knows what, healthcare or infrastructure or caring for the elderly or whatever it is that we would have used those funds for. They are instead directed towards the planetary defense to defend us from an imaginary threat.
Is that the same as the opportunity cost, or is there a distinction between talking about opportunity costs and the unseen in this case?
That's a good question. I think they're used a little bit differently. But I mean, both are really intended to focus on what the core thing that an economist does is really to look at both sides and look at everything as a trade-off.
Okay.
And I think the American president Harry Truman once said that, well, he exclaimed that he needed a one-handed economist, because economists always say on the one hand, and then they say, but on the other hand, right? So it's always the trade-off, and economists are sort of famous or maybe infamous for always pointing out those both sides, and the opportunity cost is exactly that, right? That's how you figure out which option is the best one, and the seen and the unseen is making sure that you actually look at both sides.
Oh, okay.
So I'm drawing from that in the book, and then I'm adding the unrealized as sort of an addition to Bastiat's famous essay, where I argue that it's not only the case that we have to look in every situation at the seen and the unseen, but also that if we restrict people's actions so that people cannot pursue what they would want to pursue, that means that the effects are different from their actions too, which means other people get to choose from a different set of products. So in basic economics, with like putting the entrepreneur at the center, and what I teach my students is also that to be a successful entrepreneur, you have to figure out how to best serve other people. That's how you figure out who is willing to pay the most for the product, who is benefiting most from your product. That means you maximize your revenue by serving them the best you can, right? But if you restrict his actions so that he has to do something else, then those very highly valued goods never actually materialize. Those are actually never produced. I mean, something else is produced, of course. There's the seen and the unseen, but that other thing that is produced is something that the entrepreneur considered to be less valuable than what he otherwise would have pursued. Which of course means that the other side of it, whoever would have chosen to buy those products can't buy those products because those products are unrealized.
Okay.
And the problem there is that we never know what we're missing, right? We never see what never happens.
Right. So that ties into what the effects of regulation. But can you make that? Can you sort of close that bridge a little bit more between how the regulation affects, the unrealized? Let's say the government comes in and says, we need safety standards for widgets, and you need to build them in a certain way.
Yeah, exactly. So that means any regulation, we tend to think of regulations in terms of the intention rather than what is actually going on or what they actually are. So I'm debating this with a lot of people online and elsewhere, and people get really pissed off by my simply saying that regulation is a restriction. And it is nothing else, because regulation means you cannot do this certain thing, or you cannot do this thing other than this way, right? So you're restricting the options in your actions, and that's what a regulation is. But we tend to sell the regulation and even come up with the regulation because we want to bring about a certain future that we think is better than otherwise would happen, right? So you mentioned safety regulations. The most recent one, or the big one, would be masks for treating COVID-19 patients, right? That they have to have medical grade. They have to be really, really good masks. You can't use any mask for sawdust or whatever, but it has to be medical grade masks. Well, that seems like a pretty good idea, right? Why should you provide medical staff with masks that don't protect them as best as possible, right? Well, then something happens, meaning that you need a whole lot more masks than before. And then that restriction really says that, well, you're not allowed to use any other mask than this one that you can't really find anymore because we're using so many more of them than before. Which means that your choice is no longer, a good mask or a semi-good mask, because your only choice now is without a mask. It's without a mask or a semi-good mask and breaking the law, right? So the regulations are restrictions, and sometimes normally they might be good, or we might think of them as good, but as soon as something changes, and the world changes all the time, it becomes a very, very blunt tool to use. I mean, it's not easy to predict what is going to be the outcome of these regulations. And I mean, since regulations are restrictions, it means that always entrepreneurs cannot pursue what they think is the best and most valuable outcome, right? So with the masks, you would see plenty of companies wanting to redirect their production towards producing masks. Well, if you don't have a license, if you don't have the certification, and if you haven't had previous FDA approval and all this other stuff, you're not allowed.
Okay.
Well, that means that we don't have the masks.
I can think of two responses, perhaps to that. Or so one would be that number one, that the restriction is actually for something that people would choose if they had the wisdom or the knowledge and the foresight, and in a way, it's a restriction that is, that is making a choice for them that they should be making. And then the other one, I mean, perhaps we'll take them separately because I think I'd like to explore each one of them. But the other one would be, well, if you don't have the restrictions, then the public may actually demand them just because they'd be flooded with choice and they won't know which, what's best for them, and so they want some kind of authority to tell them exactly what the best choice is.
Mm-hmm. No, and I think both of them are really based in the view that people can't really choose themselves because they might choose the wrong thing. Mm-hmm. And that might very well be the case, but on the other hand, people have to live their own lives. And who knows what is the right choice for you? Well, if it's not you, who else? And I don't think that we can capture this additional wisdom, as people want to put into regulations, through a simple law, because that law is going to be universally applicable. It has to be enforced in certain ways. And of course, it has to go through a Congress that is affected by campaign contributions and lobbying and all these things too, right? So many things can and do go wrong with just coming up with the actual formulation of the regulation. So, I mean, in the perfect world, a regulation would work perfectly, but we also wouldn't need the regulation. Since this world is imperfect, an imperfect regulation might cause a whole lot more harm than not having the regulation to begin with.
What are examples of that?
Of causing harm?
Mm-hmm.
Well, I mean, the mask regulation would be one, right? Lots of medical staff not having masks for the simple reason that they're not allowed to use masks that are almost as good, but not really. But there are plenty of these regulations that I mean, they can be harmful in themselves, and they have unintended consequences as well.
Mm-hmm. How do I, as a doctor, who will guarantee to me that this respirator that I'm putting on and walking into a patient's room that potentially has a lethal virus, how am I to feel good about that mask if there isn't some regulatory body that samples it once every X number of days to do it? Whether that could be a private organization,
sure,
but it seems like there's going to be a demand for. I mean, certainly there'd be a demand from me to get that type of information.
Oh, of course. I mean, and you can't test every machine or piece of equipment that you use to make sure that is this one as good as the last one, or is it at least as good as I require in whatever it is that I'm doing, right? But a business also doesn't actually make money off of tricking people and providing you with poor things, especially in the competitive market. So a business that wants to survive in the long haul and wants to make money and have relationships with their customers, which is how you make money, then you provide them with the best good possible.
The interesting thing is that in other markets, say like India, for instance, right? The brand of U.S. made is very, very strong, and the brand is so strong that because they recognize that the regulatory framework here is very challenging for whatever reasons, and that, you know, boy, if the stent is US made, that's the stent I want. You know, well, we have the Indian stent that is local, but I have no idea, you know, the manufacturing processes, all that stuff. So do you find that interesting that there's a demand in these markets that have, you know, are much lighter on the regulatory piece of it, but there's a demand for US style regulations in these places? It's a value proposition for them.
Yeah, absolutely. And I mean, you want this, I mean, it all comes down really to quality assurance, right?
Right.
That because the regulations here are stricter, you can use the approved by FDA or whatever as a shortcut to quality.
Right.
Of course, it might not be a very good shortcut, and it's based off of laws and regulations that don't change very often, and that have been pushed through Congress and different committees and so forth, affected by campaign donations and all this. But it's better than having nothing at all, perhaps.
Right.
But the alternative is not having some kind of regulation or having FDA or even the illusion of what the FDA actually accomplishes, which is how people usually evaluate it, and nothing at all, but rather having companies selling products competing with each other using quality. I mean, quality and price, those are the only two dimensions you can compete on. And frankly, if we talk about medicine, healthcare specifically, we all want high quality healthcare, of course. But the option is not high quality healthcare or no healthcare. The option might not be high quality healthcare and low quality healthcare, but might actually be, for some people, low quality healthcare or no healthcare at all. And then if you have regulations in it, no, you can't have healthcare that is not a tip-top standard, that's illegal. Well, then the option for many people would be zero healthcare or black market. And that's probably even worse than not having the top-notch kind of healthcare.
Right. I think one of the issues is that there isn't a competitive regulatory market, right? I think one of the problems is that because I think there's a big demand, especially in healthcare, because, you know, the issue is that unlike a TV, like you turn on a TV, the picture is beautiful or not, right? It's something that can be easily seen. Whether or not the stent that you put into your heart, you know, how quickly that collapses or how much tissue grows on it based on how much drug is impregnated in it, or what the little pill, the white pill that you have, whether it has enough of the active ingredient to make your blood pressure go down, those are things that are kind of based on faith. So I'm pretty sure that there's going to be a big demand from consumers for some type of certification. Of course, the major problem seems to be that the government kind of crowds all that out, and you only have them kind of stamping, and eventually, because they're a bunch of bureaucrats that aren't very responsive, you know, and they're mostly self-fulfilling. Their mission is to pad their, you know, to pad their retirement accounts or whatnot. You know, do as little as possible to get to an age where you can retire and have full pension or whatever the heck it is they have. It ends up being an ineffective regulatory body.
Yeah, absolutely. But the regulation there, when we're talking about quality assurance, that's only half of the equation too, right? Because the other half would be the threat of liability. That if you do something and produce something that, even if it passes through quality assurance, as it is now, if the government has approved it, it's approved, and you can't really do much about it, right? But if you have a certification by a private organization, and they say, well, we guarantee this, then they can be held liable too.
Right.
So it's in their interest to actually make sure that the quality is top-notch, which is not the case for agencies.
Yeah.
Absolutely. So that's a very interesting, because can you tell us historically, before, I mean, we live, the difficulty here is that we've grown up in a regulated world, and we have no other, you know, framework to compare it to. What would it look like, you know, along the lines of what you were just describing, or what did it look like perhaps before regulations were so pervasive in terms of these types of, you know, quality controls that are not necessarily direct quality controls by agencies, but sort of an indirect ways of ensuring that the products are working as advertised?
Well, I think there are some examples of sort of not regulated markets and so forth, but they are usually very far back. So they're not as advanced as and complex as the ones we have today. So they're not healthcare the way we think of healthcare. I mean, the first regulations of that kind would be only approving some people as doctors, for instance, or getting rid of snake oil salesmen. So, I mean, we're back a couple of 100 years or so. And that also probably seemed like a good idea, but those markets were very different too. So in these markets, very often the argument would be that a complex advanced market, it's so hard to know, and you mentioned before that there's so much to choose from perhaps, so how could we know? So maybe it was easier back then with not so complex markets and not so much specialization and all this stuff to not have regulation. But I would say it's the other way around. That back then, information and communication was really, really poor. So you could travel as a snake oil salesman from one town to the next because they didn't know anything at all about what happened in the previous town. And you didn't have a reputation as a salesman either. But today, with the internet and everything, if you make a mess, then it's easy to figure out that you made a mess. And it's easy to follow you around, and it's easy to have sort of watchdog organizations to warn everybody about you too. And I mean, I think a sort of free market version would be to have all these organizations do pretty much Yelp reviews of everyone and everything, and inform people back and forth of, is this a good guy or a bad guy? I mean, you can do that with healthcare providers and dentists and so forth now, right? You can go online and look at, is this a good guy or not, and you can read some reviews. But there's a big market gap for organizations doing this that take donations from just private individuals or whatever, and their job is simply to provide them with good, reliable information. Who is a snake oil salesman and who is an actual medical doctor?
But you know, Per, I'm not super familiar with it, but I know a little bit about the history, at least of the pharmaceutical industry at the end of the 19th century. And in fact, even then, firm reputations were actually quite important. The Merck company, for example, I mean, speaking of snake oil and whatnot, you know, Merck was the first one to develop cocaine as a pharmaceutical, and then as soon as it became apparent that it was actually harmful and addictive and whatnot, they voluntarily took it off of their offerings or what they so it didn't really require an agency to come and shut them down, or try to have the DEA or to have the FDA shut them down. They actually voluntarily did that, and the brand names in those days were extremely important and much more valuable than they are now. They still carry some importance this day, but it seems much less so as we rely more and more on the FDA to tell us, what kind of drug we can use, and generics and whatnot. And we had an episode on the failure of the generics market being precisely a failure of the regulatory agencies, who sort of lull us into thinking that these products are equally safe or equally acceptable or of equal quality.
Yeah, that's a very good point. I mean, brand names, I mean, that's how you show that this is my stuff, and you work in a brand name so that it's in consumers' their conscience about what types of products you provide, and that you have a quality standard and so forth. And that's some kind of trust, or you can rely on them to some sense. People seem to think that this is a problem, that people rely on brand names and brands, but it's the other way around, right? It's actually a service to consumers, that if a big brand suddenly causes a bunch of people's, say, bad health or even deaths, that brand name is dead. Right? Mm-hmm. Everything they have invested in that brand name, it's gone, because no one will trust you anymore, right? So they will gladly, or they have to invest billions and billions in saving the brand name if they screw up somehow, right?
Right.
We saw this with BP and the deep oil drilling thing, right? In the Mexican Gulf, when this didn't work out well, and they were probably following the regulations and all this stuff, so they thought they were safe. But then there was this disaster, and I think they offered to start cleaning it up, and they had all these campaigns, and they invested billions and billions and billions in trying to save what could be saved of their brand name. Because if people don't trust it, if people don't want to buy BP because they killed all animal life in the Mexican Gulf or whatever, they lose everything. Mm-hmm. Right? So it's a good deal for them suddenly to invest billions and billions of dollars into saving the brand name. Whereas when they probably did, if you invest beforehand in making sure that nothing goes wrong, that's so much cheaper. So that's how you make money. So that's actually a control on it's a shortcut for the business. They can write off of that brand name, but they have to create it and they have to maintain it. And that's a service to consumers.
Right. Yeah, no, absolutely. And I think you're right. It's very well underestimated, sort of the value of the brand name and the value of the long-term relationship with customers. And a case in point is now all of a sudden, bringing it up to the COVID pandemic. All of a sudden, the FDA is allowing a lot of companies, clearly they cut themselves, and we talked about this on a previous episode, but they were, cut themselves flat-footed in their response to the epidemic and having enough tests on the market to test for COVID and whatnot. So now they're using this Emergency Use Act to allow a lot of company to provide antibody tests, right? So not tests for the actual infection, but antibody tests to see if people have been previously. And now I'm confronted with having to choose between 20, 30, maybe even 40 companies that make these tests, and I have no idea, right? Because I have no relationship, no pre-existing relationship with any of them. No idea how to choose one versus the other, or I'm kind of at a loss, because all along I had been sort of relying on the regulatory agencies sort of vetting all the testing and all those problems.
Of course, they had brand names as quality testing or whatever, right, then it would have been easier to know that, okay, well, I've used them before, or I know people who have used them before and they have high quality and they guarantee this or that, and I get my money back if it's wrong or whatever. Then it would be much easier.
Right.
But they're still controlling this, right? So the emergency use authorization, this CDC filed to the FDA, and the FDA had to approve it, and then they started loosening up because the only lab was the CDC centrally, right? And then they approved of some other labs throughout the country to do this. But they're still cracking down on others supplying the service. So I saw someone I think somewhere in Florida, offering drive-through testing for a couple of $100 or something like that. And of course, there was a long line on cars because people want the tests. Whether they actually need the tests always, I'm not sure, but they wanted the tests and they wanted to buy them from this guy because it was hard to come by a test. And of course, the authorities, they shut him down.
Yeah.
Because this was not an approved testing facility, which sounds good, but what does it mean? It means just that he didn't have the approval. It doesn't mean that this was a poor test. It doesn't mean that the test didn't show anything accurately. It doesn't mean anything like that. It just means that the authorities had not approved it. It could have been just as good or even better tests. Who knows?
Right. And if we had known, because I don't know really by brand name of any sort of testing company that I could say, okay, well, they're putting their brand name behind it, and therefore I can trust because they have decades of experience and so forth. Whereas now it's just whenever we order a test, it's just order the test without any regards to who's providing the test or what kind of quality control there is behind it.
Yeah, but that goes for most of healthcare, right? There are no prices. No one's going to tell you prices. No one is going to tell you really what they're doing or why. If there are any options that you can choose. Very often there might be some other test that might not be as accurate, but might be a whole lot cheaper. shouldn't you then as a patient be able to choose that? Well, no, you can't, because it's regulated and the insurance company demands this or that and all this stuff. So basically you're blind every time you see a healthcare provider, because they either can't tell you or they won't tell you this information, but you're a consumer.
Mm-hmm.
Of course, if it's emergency care, you might not be able to choose this or that, but then you could have a specific insurance plan or whatever beforehand. But I mean, I saw my healthcare provider not long ago, and the way they did it, well, I guess was standard practice. What they did was say, come 15 minutes early for paperwork and all this stuff, which means, okay, those 15 minutes is me working for you, right? And so I show up a little early. It usually doesn't take 15 minutes, whatever. And then it's my time and the doctor's not ready. So I have to wait 30 minutes before I'm actually get into one of those little rooms. But I only see a nurse, and then I wait another 10 or 15 minutes, whatever. So it's been an hour before I see the guy. It's nothing urgent, but I just want his opinion on something. And then he spends 10 minutes with me, and then I walk out. And of course, they can't tell me what anything costs. They can't tell me what exactly they're doing or what they're thinking it might be, because liability and whatnot else. And then I have one of these high deductible plans. So you get a bill, $270. And I think, holy crap, $270 for 10 minutes? And I worked 15 minutes on the paperwork, and then I waited 30 minutes. I mean, it goes back to the opportunity cost.
Right.
What could I have done with 30 minutes in my life, except for just standing there waiting with sick people?
Yeah.
I could have made a lot of money, probably. I could have done something fun. So the $270, and I contact them. I write a message through their online platform. I try to ask them, okay, so what is this for? Why this price and everything? I end up with billing, and they tell me, oh, we don't know anything about the price. We don't actually set the price. That's for the doctors. This is just the billing department. So you have to ask them. Okay, so I find some place to contact them in their platform thing. And I end up with the billing department again. And this time they say, no, we have nothing to do with pricing. You have to check with your insurance company. Okay, so I check with the insurance company, and they say, no, we don't actually do anything with the prices. The doctors tell us about the prices. Okay, so I get back to the healthcare provider's office, and again end up with billing, who can't tell me anything at all. They just apparently print the bills and send them to me. And I tell them, well, $270 for 10 minutes. That's usury pricing. This is nowhere near what it's worth.
Right. But it clearly meets the service that you had. This terrible service clearly meets all the standards of the industry, right?
Right.
Because it meets the standards of the insurance industry, right? Because the insurance industry is under the purview of the insurance boards in every state, and those insurance companies, they pass their standards. The professional standards for the doctors, right? They've been met, right? Because they fulfill the ones for the whoever pays, the government, the safety standards, all of this. It meets all the standards. So
right, all the regulations, they comply with all of them. The only thing that is missing is that the consumer has to say what they're buying, how much, and when, right? Which is usually the case in any actual market. So
that speaks to a feature, I think, that the regulation seems to make markets anti-competitive, right?
Yeah, and because
so
there are restrictions.
Correct. So then everybody has to follow, and so they mold everything into a standard product. They mold all the services available into a very standard product. So it's no surprise that you can't find anything else. I mean, at least you can, but it's very, very, very difficult.
I mean, what it really means is it's a prohibition of innovation, right? Because you can't do anything differently, because as soon as you do something differently, you do not comply with regulation anymore, which means you're not approved, which means you cannot offer the service. And of course, innovation, it could be for better or worse, but that's just the issue, right? Innovation is usually undertaken because it improves quality or it lowers the price. But if you can't innovate, what do you end up with?
Right.
Well, you end up with the same stuff as yesteryear.
Yeah, and of course, the mother of all regulations is. That's what I keep harping on it, to the dismay of my co-host Anish here, is medical licenses, right? And medical
Hmm.
licenses, if you look at it historically, it really is it's the thing that got the ball rolling, right? It was the first thing, and then boom, boom, boom. Then after that, you had all the rest of the regulations sort of followed rapidly behind. And you're right in that before the medical licensing, clearly you had a wide range of quality available in terms of the skills of the doctors, but it was extremely affordable. Medical care was extremely affordable, and even with pretty high quality care for the time, like you could go to the Mayo Clinic, which existed before regulations, before licensing, and have really pretty good surgeries. I mean, quite amazing surgeries for the time. I mean, respectively for that time, at a really affordable price. And the Mayo Clinic could afford to give a lot of charity care and whatnot. So they were not, even though it was affordable, they still could make a good living.
Yeah, I
So
mean,
it's yeah.
licensing is, I mean, that's something that's been studied by economists for a long time. And I mean, what licenses do, it doesn't matter if it's healthcare or if it's barbers or whatever it is. Um, Usually what drives this type of regulation is the how much wages you can increase by
Hmm.
simply
Hmm.
enforcing this, right? So what you're doing is really creating a guild.
Right.
But whoever is not a member, you cannot offer the service. You're not allowed, or you can even use the powers of the state to make sure that they never again try this and that they stop immediately and this sort of thing, right? So you restrict supply, whereas demand is still there, which of course raises prices and
Mm.
increases salaries and so
Right.
forth.
Right. Which is exactly what happened immediately after the licensing laws were passed in the U.S. That's the beginning of the medical inflation, and it's been there ever since then. So how do we get out of this? I mean, because at the same time, it seems to be that we're in a situation where if we want to go back to a less regulated or unregulated market, whether it's healthcare or not, it seems that it's a this crutch, right? This regulation crutch is one that is hard to get to let go of.
Yeah, definitely, because people have this perception of it as something that controls quality,
Mm-hmm.
right? Uh, and this is a very strong emotional tie, I guess, to this. And so I don't think, and frankly, every regulation that you roll back, you're going to see some idiot take advantage of it and do something just for the quick buck, right?
Right.
And those are going to be all over the media.
Sure.
And that's
Sure.
going to be another push by everyone to, just get the regulation back because look at this guy, he was not there before, that sort of
Sure.
thing, right? So I don't think it's politically possible, and I don't think it's possible to um, change people's perception of them either. I mean, you can point out all these bad examples, but usually the response is, well, without the regulation, we would have even more of those bad examples,
Mm-hmm.
which is just an
Mm-hmm.
emotional
Mm-hmm.
response, right? Because that's not actually looking at the unseen. It's just assuming that the regulation does what people tell you that it does, or what it's intended to do. I think what we will see, and the sooner the better, is what sometimes is called like an Uberification of healthcare. And what I mean by that is that Uber did not start out as a taxi company just competing with taxi companies, because that was a highly regulated space and you have to do it in a certain way. And if you're in New York City, you have to have a taxi medallion before you can have even a taxi and all this stuff. So it's highly regulated. So what they did was offer a similar service from the point of view of consumers, but very different from the point of view of regulators, right?
Mm-hmm.
So it's not a taxi company because they don't own cars, and they don't roam the streets either to pick up people, and they don't have a call center that you call either, right? So it's really a matching service.
Right.
And I'm not saying healthcare should be a matching service, but I think that what we will see is probably alternative medicine then turning into more people engaged with like the free market medical association, offering alternatives that are just as good and still by real doctors and all this stuff. but offering it in a different way. And that will itself undermine the whole business and change how it is done.
Right.
So I think that is what we're going to see. And there are some industries that are sort of really ripe for this type of thing, and it's higher ed and it's healthcare.
I hope so, and certainly, physicians who see it that way should really make sure that we highlight the fact that we're essentially going against the existing regulations, by trying to provide a better and cheaper service, precisely because we we avoid, we try to avoid as much as possible the existing regulatory framework.
Right, and there's plenty you can do, I'm pretty sure.
Yeah, no, clearly. We had Keith Smith on the show. We had the current chief executive of the Free Market Medical Association on the show. So I think it's a matter of time, and perhaps this pandemic also offers some opportunities. Again, because the regulatory agencies are find themselves caught flat-footed in how they respond, and hopefully we'll have some companies that can and seize on that opportunity and want to establish brand name recognition and see the value of reputation, and establishing that relationship directly with the consumer. Which is really the only way out. Yeah.
The time is pretty good now for offering a service guaranteeing care in the next pandemic, right? So you could start a business with real healthcare providers with a reputation or whatnot else, and then sell a specific insurance for a pandemic, saying that we will make sure that we have the resources and the facilities and the staff and everything necessary for the next pandemic, so that you and your family are safe. Mm-hmm. Right? Which will, of course, it has two effects. One is that consumers will find great comfort in this. If they can trust it, they will buy this service. And it also means that they will not be a burden on regular hospitals whenever there is another pandemic, right? So there will be more resources available, because this company will have resources that they're just basically sitting on until the next pandemic.
It's a very interesting thought, and certainly something to think about for in places where healthcare systems are quickly overwhelmed by the pandemic. So maybe that's a segue to talk a little bit perhaps about Sweden. And I don't know, I don't want to put you on the spot, because when we agreed to have this conversation, we didn't say that we would necessarily speak about what's going on in Sweden, but obviously it's in the news. And so what are your thoughts about Sweden's decision not to institute a lockdown, and what's happening, and how that narrative is going to spin over the next few days or few weeks?
Well, I mean, I think there's a narrative forming in the world, which might not necessarily be true, which is, I guess, usually the case about narratives. But I mean, I have all of my families back in Sweden, old friends and everything like that. And I talked to parents, both in their 70s, yesterday. Mm-hmm. And they are following the recommendation, because they're a high-risk group, to stay at home. So they stay at home. They meet.
So tell us a little bit what is actually the status of what is allowed or not allowed or in Sweden at this point.
Well, it's a little bit up in the air, since it's an ongoing political process.
Right.
But what they've done is basically rely on recommendations rather than restrictions.
Okay.
So they have recommended anyone who is in a high-risk group, mm-hmm. To stay at home, and they recommend everybody else to engage in social distancing.
So restaurants are not shut down.
Right. So restaurants are not shut down, and I think they have just updated, so you can't be in groups of people more than 50 now. It's 50.
Okay. So sporting events and things like that are probably canceled.
Right, those are canceled now. They weren't before.
Okay.
But it's not the case like here in the U.S., where the governors and I guess the federal government too simply says that, well, you're an essential business and you're not essential business, and if you're not essential, you're shut down. Mm-hmm. You're not allowed to operate. In Sweden, all companies are operating. I mean, I was going to say as usual, but obviously things are a little different. but
at their discretion, more at their discretion than
yeah,
necessarily.
and they're being a little bit innovative. I mean, it's curbside delivery, and they do sales using like FaceTime or some other app, things like that. But there are restaurants are open. People are enjoying the sun on the patios, but I think they have updated the regulations a little bit, saying that you need to keep people at a greater distance than before. But people are there. They're having drinks and enjoying themselves. So it's different than it used to be, but it's not a whole lot different. It's not like here. I'm in Oklahoma, where you have the shelter at home and all this other stuff, so you're not actually allowed to go out. I don't think it's enforced, since you're allowed to do a whole lot of things still, like take walks and go to the grocery store. But many businesses are simply shut down. And that leaves you no option, right? You say your family's well-being and everything depends on your small business, and you're not in an essential category, then you're screwed. Sure, there are government loans, but I mean, are you going to get one? That means you need to be savvy with the bureaucratic process, and you have to go through with the documents and all this stuff in order to get the money, and you need to get the money in time and things like that. And you probably have a bunch of costs, and you still have to pay your bills, or you will lose everything. So in that sense, I mean, Sweden, it's a little ironic that Sweden is suddenly sort of the beacon of liberty in terms of their response to the pandemic.
Exactly. How do you explain that? And that, of course, that may change, tomorrow, because the numbers, however we, whatever they are, and they're so hard to interpret and believe, but the numbers, first of all, seem to be a little concerning. And what was your take on that?
Well, I've been trying to follow the Swedish news a little bit.
Right.
And it seems they're not very worried in Sweden about those numbers, because they're a little bit, first of all, they're better at tracking. So they say that the Swedish Statistics Institute can follow anyone using the Social Security number, basically. They can tell immediately if you've died and from what and all this stuff. So their numbers are a little higher simply because they can track deaths. That's one. They were unfortunate to get the COVID-19 into homes for the elderly early. So it was I think they said they had COVID-19 in 40% of all the homes for the elderly in Sweden. And of course, that's a high-risk group.
Sure.
So that caused a lot of death. Other than that, I mean, it's...
Do you know if the hospitals are sort of overwhelmed, or is there anything of that?
They are not. I mean, there's more than usual, and I know that in Stockholm that is most affected so far, because that's where it started, as in most countries in the big cities. They built like military hospitals and things like that. But last thing I heard a few days ago, they had 0 patients in those military hospitals. So the hospitals they had before and everything, I'm sure there are more people being treated than before, but it's not a huge problem. They're not running out of hospital beds or anything like that. I know they have advertised for recently retired personnel and people still going through their education or pre-licensing, that sort of thing, and ask them as for volunteers to work in the hospitals. And they got thousands and thousands of people responding and starting to work. So that has not been much of a problem either, at least not so far.
Okay. Yeah. And so why do you think Sweden is different in its response compared to Norway or Denmark?
Well, I mean, one reason that the government is pushing as an explanation is that there's simply no legal room for them to do this.
So they're actually very, they're being so much by the book is actually in favor of liberty here, as opposed to
that's
sort of creatively, conjuring some rise of governments to shut down an entire country just because of a virus, right?
Yeah, I think that's what they're claiming, which is a little odd because, I mean, in the US, you would have a lot of protection for property, where Sweden would be not as much, right?
Right,
But
yeah.
here you can shut it down, apparently, no problem. But I think that is might be part of the answer, but that's also a reason for the government to push for more government power, right? And they are discussing that now. There's emergency laws, but they are specifically for war situations, so they can't rely
Okay.
on those. So they're trying to update those. I think the main reason, though, that it actually works without shutting things down by force is that Swedes really trust the institutions. So Swedes trust the government, they trust the agencies, and they're compliant.
Right.
So just like my parents, no one is telling them that they have to sit at home. No one is calling the police if they're not at home. But the authorities are telling them every day on the news that they should stay at home because they're high risk, and like make sure not to meet your grandchildren too often and things like that, right? And stay away from sick people. So they do that, right? So there's a lot of trust in the Swedish social life in general, and Swedish authorities and agencies are trusted. I think that is a big reason for why it actually works with recommendations and
Right.
not forcing.
Interesting. More so, you think, than Norway?
Was that?
You think more so than in Norway, for example?
I would think so.
Okay.
Yeah. I don't dare saying why. That
You
might
know,
be.
and let me ask you also, there's, speculation, but Sweden has also an entrepreneurial and actually capitalistic history. And it's maybe
Yes.
not too distant past, right? It was actually a very capitalistic country up until the 1950s.
Yes.
I may link to I think a podcast where I heard you talk about this that history. So is there also, nevertheless, I mean, despite the regulations and the socialism and whatnot, nevertheless, a spirit which would go along with that trust of trusting people to do the right thing in a way, and allowing some free enterprise in terms of how you move about your own body and your own person in society.
Right. Yeah. No, I think that is right. I mean, there's definitely an entrepreneurial spirit among Swedes. I think it was harmed for sure with the huge welfare state that was built. But you're right. I mean, in 100 years, Sweden went from the poorest country in Europe to the world's fourth richest.
Mm-hmm.
And that was entirely due to free markets, because it started out with deregulation like crazy and basically tying the hands of government and the king and all this stuff. And Sweden, as a small country in Europe, has always been dependent on trade. So even socialist governments has always been open for trade, because what else can you do, basically, right?
Right.
So the Swedish system is very, very strange. I mean, from an international perspective, because it depends on such things that no one ever thought might actually work, or why. So I mean, the labor unions are really strong. There's this weird meeting every year with the national labor unions and the employers federation and the government, and they're discussing how much to raise wages overall. I mean, it sounds pretty corrupt, and you could claim it is. But the labor unions, they also realize that they shouldn't push for too high wage increases, because that might lead to inflation, and we don't want that. So everything is sort of reasonable, and
Mm-hmm.
that's very core to a
Mm-hmm.
Swedish mindset in general. I think reasonable and no extremes whatsoever. I mean, the Swedish history, I mean, it's known for the huge welfare state with the
Right.
Universal welfare benefits and everything, but that only lasted for 20 years. So it really started in 1970, and Sweden was bankrupt in 92. And after that, Sweden has been deregulating and lowering taxes, well, since then, pretty much consistently.
Right.
So I mean, history it's much more complicated than it's usually made out.
Sure, it certainly is. And healthcare, of course, I think is still very regulated in Sweden. And
yes,
And just briefly, what's your assessment? Because I've read, Sweden is always taken as the example to follow by the democratic socialists. That this is what the example. But I have heard not so rosy things about the healthcare system in Sweden, especially if you move away from Stockholm and go into more rural areas. What's your take on that?
Well, I think there are two stories to be told about Swedish healthcare, and one is that quality is really good. Anything you can measure in terms of the number of staff and the machines used and everything like that, it's really good. The problem is access. So depending on what it is, it could be really difficult, and the wait times could be really long. So I actually had an op-ed in the Wall Street Journal, well, a long time ago. It was when we were discussing whether to have Obamacare or not in this country. And I compared with Sweden using official statistics from the Swedish authorities. And I mean, some types of cancer, you could wait for 18 months for a decision about whether you would get treatment.
Wow.
And I mean, obviously people die while waiting, right? So
and they're not counted as right. They're counted as death from the disease, not as death from
of course,
from the shortage. Yeah, right.
They died from cancer, not from being
right.
not treated for cancer.
Right. Well, I'll link to that. To that article, and it's been great. Per, where can people follow you? I want to really recommend actually everybody to follow you on Twitter. You have really outstanding economic teaching points on Twitter, and they get lots of retweets and follows. And so,
thank you.
Tell us. I'll have that on the show notes, but tell us your Twitter handle and maybe your website.
Sure. They're basically the same. So they're both my name. So my Twitter handle is Per Bylund, PERBYLUND, and my website is perbylund.com.
Terrific. Thank you very much.
Thank you.
Thanks so much.